Good afternoon, and thank you also for the invitation. I'm really pleased to be here. And today my presentation will be on Reimagining PET, clinical expansion beyond oncology and real-world barriers. Oops. I'm not seeing my presentation, my slides. Sorry. Over the last decades, PET has profoundly transformed cancer care, particularly with FDG imaging and a large variety of emerging biomarker and PET tracer that we cannot see on these images. PET provides unique opportunities for earlier and more precise diagnosis. Expanding PET beyond cancer is essential to address the growing healthcare burden associated with an aging population, the rapid rise of neurodegenerative disease, the persistent impact of cardiovascular disease as the leading cause of death, and the increasing need for earlier and more precise diagnosis. With its high molecular sensitivity, quantitative capabilities, whole-body assessment, and companion diagnostic potential, PET is becoming an increasing powerful tool for personalized medicine. The recent emergence of disease-modified therapies for Alzheimer's disease, including the anti-amyloid beta antibodies lecanemab and more recently donanemab, has substantially increased the clinical importance of PET imaging, which now plays a central role in diagnostic, patient selection, and longitudinal monitoring of treatment response. Emerging neurological applications include amyloid imaging, tau imaging, neuroinflammation imaging with a large variety of TSPO PET tracer, synaptic density imaging, and more recently, on the preclinical stage, early detection of toxic soluble amyloid beta oligomers with copper-64 as a peptide. And we cannot see it on the image. Together, these advances enable earlier detection for neurodegenerative disease, improve selection of patients for anti-amyloid therapies, and more precise assessment of disease progression and therapeutic response. Neurology is rapidly evolving from a symptom-based approach toward molecularly guided medicine, with PET biomarkers becoming increasingly integrated into diagnostic algorithms, clinical trials, and therapeutic decision-making. This transition is driving precision medicine in dementia, while also highlighting some challenges related to access, reimbursement variability, standardized interpretation, and the growing demands for tracer production. Cardiology is emerging as a major growth area for PET, which enables quantitative assessment of myocardial blood flow, visualization of inflammatory and metabolic processes beyond the capabilities of conventional anatomical imaging. Expanding applications including myocardial perfusion, cardiac sarcoidosis, infective endocarditis, arteriosclerotic inflammation, and myocardial viability underscore its increasing clinical relevance, supported by high-sensitive, robust flow quantification and detection of active inflammation with tracers such as FDG, fluoroperidase, and even gallium FAPI. And novel inflammation-targeted probes further expanding its application, its impact. As cardiovascular disease is increasingly understood as an inflammatory process, PET provides an unique opportunity to identify active disease before irreversible structural damage occurs. Imaging of inflammation and infection is one of the fastest growing areas of PETs, with applications spanning autoimmune diseases, vasculitis, inflammatory bowel disease, infection imaging, and immunotherapy monitoring. This field offers important opportunities for non-invasive whole-body assessment, earlier therapeutic adaptation, and personalized treatment monitoring. PET is no longer limited to diagnosis, but it's increasingly central to treatment selection and optimization, particularly in the context of theranostics, as you have seen today. It helps identify patients most likely to benefit from specific therapies and support ongoing assessment of therapeutic response. More broadly, PET is becoming tightly integrated with treatment strategies with emerging direction, including neurology theranostics, immune-targeted radiopharmaceuticals, and personalized dosimetry. Real-world implementation of PET innovation remains limited by several structural and operational barriers. Despite strong scientific progress, translation into routine clinical practice is constrained by radiotracer production capacity, cyclotron and infrastructure limitations, regulatory complexity, reimbursement uncertainty, workforce shortages, and the lack of standardization across centers. In addition, practical constraints such as short half-life logistics, GMP manufacturing requirements, and multi-site harmonization further complicate deployment. Overall, the gap between innovation and clinical implementation remains significant, and many promising tracers fail to reach routine use to ecosystems that are not only fully adapted. Successful integration of PET into routine care requires coordinated system-level strategies rather than isolated technological advances. First, infrastructure must be expanded to regional radiopharmacy networks, improve cyclotrons access, and automated production platforms to ensure reliable tracer supply. Redundancy is really essential. Second, regulatory pathways must be modernized through harmonized and more adaptive frameworks, specifically designed for radiopharmaceuticals. Third, strong clinical evidence is really essential, supported by multicentric clinical trials, health economics analysis, and real-world data to demonstrate value and sustainability. Finally, and not the less, interdisciplinary collaboration. This word was mentioned very often today, between clinicians, imaging scientists, industry, regulators, and healthy systems is really critical. Overall, accelerating translation will depend on building integrated ecosystems that align innovation with clinical and operational realities. PET is entering in a new phase defined by rapid technological and clinical transformation. Several key trends are shaping its future, including AI-assisted PET quantification, the development of total body PET system. At the same time, ultra-dose imaging protocols, and new radionuclides are expanding safety and flexibility, while personalized molecular imaging is moving PET further toward individualized patient care. Overall, PET is evolving from a predominantly oncologic imaging modality into a broader platform for precision medicine across multiple diseases, including neurology, cardiology, and inflammation. Ultimately, the central challenge is not PET's ability to transform medicine, but the capacity of our healthcare systems to adapt rapidly enough to fully unlock its clinical and societal value. On this, thank you for your attention.